Another common question is, patients will ask, what are the chances of a treatment working? And there we can have to clarify, what works actually mean. So what do we mean when a treatment works? What exactly do you want to see? So there are these response criteria. They're not super important. It's not the point. The point is not about the percentages and the numbers, but I just included these to kind of tell you the things we look at when we are assessing whether a treatment works or not. These are also tools that we use in clinical trials. So if you at any point read a clinical trial result, you might come across these definitions. Some of the physicians also, some of the doctors might actually include these in their progress notes. You might read it in your clinic notes. So a doctor might say the patient responding, they achieved a very good partial response. You might wonder what exactly that means. A complete response is the best response we can get right now. And it basically means that the IgM protein goes down to normal levels. We don't see the M protein, the monoclonal protein anymore, so it disappears. We do a bone marrow biopsy and we can't find the lymphoma cells anymore. And then we do scans and we don't find any enlarged lymph nodes or enlarged spleen or anything else abnormal. That's very, very uncommon right now with the treatments we have. So most patients are not able to achieve this complete response. In fact, we don't do bone marrow biopsies on patients after we start treatment because we don't expect the bone marrow to be clean for most patients anyways. We only do a bone marrow biopsy if we worry that it might be something else that's causing the low blood counts, or if we worry just that the treatment didn't work and there's still a lot of lymphoma cells in the bone marrow. The very good partial response is kind of the next best response. That's when you have a 90% reduction in the IgM. So let's say we started at 5,000, I gave treatment, and then the IgM went from 5,000 to 500. That's a 90% reduction in the IgM level. That's called a very good partial response. A partial response is at least 50% reduction in the IgM. So we started at 5,000, went down to 2,000. That's a 60% reduction. More than 50%, that's a partial response. And then a minor response is 25 to 49%. A stable disease is when the IgM doesn't really change much, less than 25% either way. And then progressive disease is when the IgM goes up by at least 25%, and the change in the level has to be more than a 500 milligram per deciliter, or if there are new lymph nodes or enlarged spleen. So this is very important. Sometimes I give treatment, we start at 5,000, the IgM goes down to 500, the patient's doing great, we see them in clinic, and then the next time their IgM goes up to 600, and the patient is worried that the lymphoma is getting worse. And I would tell them, although it did go up, it didn't go up a lot, it's not 25%, it's not a 500 milligram per deciliter difference. Let's check it again next time and see. If it goes up next time to 1,000 or 1,200, then yes, that's progression. But if it doesn't, then it was just a false alarm. These numbers can sometimes fluctuate. So that's why the criteria are a little bit strict. It has to be more than 25%. It has to be at least 500 milligram per deciliter. And it has to be confirmed on 2 consecutive readings before we call it progression. Now, if the patient comes in and they have a lot of symptoms and their hemoglobin is really down, that's a different story. We don't always have to kind of wait 3 months, etc. But if they're doing fine otherwise, we just don't make a decision just based on one lab reading.